So we received a follow-up question, not to our NF Studios email address, but actually on insurance forums from a poster named Lost Dollar. And this question revolved around those who continue to work past age 65 and a particular scenario, and wanted to know, hey, how would this function specifically in terms of the Part D late enrollment penalty? So let's take a look at it. Good morning, insurance agents of the senior market. Welcome back with us this morning. It is Friday, September 24th. So last week we debuted an episode of Near and Far about the Part D late enrollment penalty. Now, when most of us hear penalty, this is what we're thinking of. You know, we're thinking about referees and throwing flags and, 10 yards back down the field with no change of downs. But in terms of how this could substantively impact your clients, this is what we could be looking at. Could be looking at a lot of dollars depending on how long they may have been eligible for a Part D drug program, but not enrolled. So on that episode, we received a ton of really positive feedback and some questions to our email address, which you can see below here at nf_studios@neishloss.com. If you haven't taken the opportunity to email us, you can do so at any time you want. You got any questions, hit us with them. So we received a follow-up question, not to our NF Studios email address, but actually on insurance forums from a poster named Lost Dollar. And this question revolved around those who continue to work past age 65 and a particular scenario, and wanted to know, hey, how would this function specifically in terms of the Part D late enrollment penalty? So let's take a look at it. Here's the situation that Lost Dollar questioned. So you have a consumer who is working past the age of 65. They are qualified for Part A. They delay enrolling in Part B because they're working and they have employer group health coverage. So in this scenario, the employer plan ends on 8/31 at the end of August, and the consumer ends up enrolling into Part B, and we have a Part B effective date of 10/1. So this consumer waits for a little bit. Obviously, they still have the open enrollment period for the Med Sup. They enroll into a Medicare Supplement and a Part D prescription drug plan in January for a February 1st effective date. Now, in terms of the Med Sup, they're still in their open enrollment period. Their open enrollment period for Medicare Supplement begins on 10/1, and you have got 6 months from that date. So the enrollment in January for a 2/1 clearly would work. There would be no pre-existing conditions, no medical underwriting, and also preferred rates. So the Med Sup, totally fine there. But the Part D situation is definitely not okay. So let's talk about why the Part D situation in this particular example is really problematic. So with Medicare Advantage, the initial enrollment period, or IEP, centers around the Part B effective date. And with Medicare Part D, as in David, for drug, it is the earlier of the A date or the B date. Now, in the situation that Lost Dollar presented, this consumer gained access to Part A, continued to work past age 65, and at some point, well after that, ends up deciding to come off of the group health plan and retire. So in this situation, there is no IEP available for the client on Medicare Part D. Additionally, this consumer could not use a special election period for loss of employer group health plan. So the very famous SEP-EGHP, it's a whole lot of letters, but again, that ended 2 months after the termination of the group. So the group terminated, the group health plan terminated for this consumer on August 31st. So on Halloween, 10/31, that SEP vanished. Clearly not available in this example. Additionally, the open enrollment period, the OEP, which runs January 1st through March 31st, not available in this situation for the standalone drug plan. Only those individuals who are leaving a Medicare Advantage plan, an MAPD, or a special needs plan, SNP, we got a lot of letters today, a lot of letters, but only folks who are leaving those types of products can utilize the OEP for a plan switch. So again, no IEP available, no SEP for loss of employer group health plan, and no OEP is available for this consumer. So in terms of looking at it, barring some sort of additional election period that I'm not sure that necessarily be present, I don't think this client could enroll into a prescription drug plan during January for a 2/1 effective date. Now, if they did have a low income subsidy or state pharmaceutical assistance plan election period, they could enroll and there would be no penalty, but that wasn't part of the situation. I'm not sure if that's present or not. But in terms of talking about what premium penalty would be available for this consumer, they wouldn't have a premium penalty because I don't think they could enroll into a prescription drug plan. So, Lost Dollar, thank you so much for submitting that question back to us on Insurance Forums. Always love the suggestions for additional content. And if you got more, hit me up with them. I'm glad to be able to film some content to help you guys grow your business. So we will be back with you on Monday, September 27th. Only 1 week till the AEP starts. Be excited. We'll be back with you on 7 a.m. Monday. I'm Bill, and this has been Near and Far. We'll see you on Monday.